Hi, let's discuss fertility preservation and egg freezing. Every woman is born with a large number of eggs. That's her egg reservoir. These eggs will be used for her fertility in future. Over the years, the eggs become depleted, and since there is no production of new eggs, the reservoir empties. The rate of egg disappearance is constant and does not depend on ovulation, which means it also occurs in childhood, during pregnancy, and even while taking birth control pills. From the age of 35 onwards, the rate of egg waste increases and their quality decreases. Hence, your ability to conceive decreases significantly. How can we estimate ovarian reserve? The age of the woman is significant. At any given age, the woman ovarian reserve will be different, and there are a number of tests that can be performed to assess your ovarian reserve. Tests for FSH and E2 estradiol hormone at early menstruation stage, tests for AMH, anti-Mullerian hormone levels, an ultrasound for counting follicles in the ovaries at the beginning of your cycle. And of course, your body's response to hormonal stimulation during fertility treatments. So how can fertility be preserved? What methods are offered to a woman today? The technologies currently in use are egg freezing, embryo freezing, and ovarian tissue freezing. And it's also now possible to try and preserve women's fertility by freezing eggs at an age when the number of eggs is high and their quality is good, thereby increasing the chance of achieving pregnancy and giving birth to a healthy child. And for an important matter, by the way, maintaining the anatomy of the woman, women who choose to postpone the age of marriage or the age at which they choose to become mothers. Fortunately, the modern world today offers equal opportunities for women in the business sector, in public positions, even in the military, in the academic world, in politics, in virtually every industry. And it's about time, hey? Women today have equal opportunities, which leads to a global phenomenon in which women choose to conceive at a later age. The problem is, many of them are unaware of the limitations of their biological clock and assume that they can conceive and give birth whenever they want. Most women are interested in passing their children their genetic source, and therefore preserving their fertility by freezing eggs is appropriate. There are also women who have low ovarian reserve at a younger age for medical reasons or following medical treatments. Some women suffering from endometriosis that may damage the ovaries and the ovarian reserve. So how do we freeze eggs, and what is the process? We do it via IVF, which includes stimulation of the ovary by giving hormonal injections, monitoring the development of the follicles by ultrasound, and then testing the hormones by blood tests. We stimulate the maturation of the eggs and then extraction of the eggs, usually under anesthetic. Now that's the part when I come. Throughout this process, I accompany the patient and I actually support hormonal protocol by using acupuncture as to stimulate the blood flow to the ovaries and encourage blood circulation to the ovaries, in order to affect the quantity and the development of the follicles and the quality of the eggs. Acupuncture definitely contributes to ovarian stimulation. Now, in contrast to IVF treatments, the eggs are not fertilized, but they undergo a process of rapid freezing using Gley vitrification method. To date, thousands of births and healthy babies have been achieved worldwide after egg freezing. Some were fertilized months and even years after freezing. The younger the woman and the higher the number of eggs frozen, the more likely it is to succeed. And what is ovarian tissue freezing? In this process, ovarian tissue is taken by a laparoscopy procedure, and then sections of ovarian tissues are frozen, which contain thousands of primary eggs in the coma state. In order to begin the process of fertility renewal, the frozen ovarian tissue must be transplanted back into the body. When the implant returns to function, it can be conceived naturally or throughout an IVF treatment. The chances of success of this technology are excellent, over 95% recurrence of ovarian function and over 50% chance of pregnancy. So shall we sum up? Freezing eggs for social preservation or for medical reasons is a procedure that allows fertile women to preserve their fertility. The freezing preserves the eggs and prevents the aging process of the egg. Freezing your eggs allows you in future to thaw and fertilize them in your partner's sperm or by sperm donation. The freezing is done to preserve your fertility and allows you to thaw and fertilize the eggs in the future. How? The fertilized eggs, the embryos, will be returned to the uterus in a simple procedure in which a thin catheter containing the embryos is inserted into the uterine cavity. Best of luck for all of you, and remember, either for the very near future or for the distant future, you can plan your fertility. Good luck.